Welcome back. Black Maternal Health Week is celebrated annually from April 11th to the 17th. The week aims to raise awareness and address the disparities in maternal health that many Black women face during a time that should be stress-free. And joining us in the studio today to discuss some of those disparities is OBGYN and host of the Lady Parts Doctor podcast, Dr. Stephanie Hack. Dr. Hack, thanks so much for joining us.
Thank you for having me.
So when it comes to Black maternal health, and as a physician and educator, what do you think are the most important conversations that we should be having right now for pregnant women and women that want to get pregnant?
Oh, we're in the moment of a call to action. We've been focused on the injustices, the inequalities, the disparities, and now is a really critical time where we need to be advocating for ourselves, advocating for the members of our community, and taking action. Mm-hmm.
And why do you think that Black women are dying at a higher rate than other races?
Oh, there are so many reasons, but one of the primary reasons is the systemic racism. You know, we talk about Black maternal health, and when we talk about the disparities, you know, Black women are 3 to 4 times more likely to die of pregnancy-related causes than their white counterparts. It's not because they're Black, it's because of the perception of what their Blackness is by the people who are caring for them, by the systems that they are within. And that's going to affect the type of care they receive. That's going to affect their access to care. That's going to affect when they speak, how do we believe them when they tell us that something's wrong? And I'd say that is the number one. It is the racism in this system and the institutions that affects us.
And I was actually going to ask you a question about that because
Sure.
I hear a lot of times, you know, when Black women go into the doctor and something may be wrong, they're either afraid to speak up or they're not being heard or listened to. Do you see that happening more often, or what is your experience with that?
Well, I hear when people are in conversation with me as a health and wellness consultant, that is the most common thing I hear is they weren't listening to me. I didn't feel, and you know, that is not unique to Black women. That is women in general, but especially in Black women. And so part of the work that I do is helping to empower women, helping to educate women so that they feel empowered when they speak up for themselves, that they have the knowledge to say, hey, this doesn't seem right, or hey, I think I need a second opinion on this. And also that they have the knowledge to bring in another advocate, because sometimes you might not feel comfortable using your own voice, but you have someone with you who can also use your voice for you.
And what do some of those advocates look like? Are they doulas? Are they someone else in the medical field?
They can be. You know, you really need a multidisciplinary team, be it your OBGYN, your midwife, your doula, your family members. All of these people can be an advocate for you.
Gotcha. Mm-hmm. And how does your platform contribute to improving Black maternal health outcomes?
Sure. So my platform was created to focus on that critical gap in education. I start with providing education and information. I start there. And then, you know, it's unique because I am not just an OBGYN, but I'm also a Black woman who seeks the same type of care. And I have kind of an understanding to be able to translate, like, hey, this is how you're feeling as a patient. And then this is what your healthcare provider is dealing with or thinking, to just kind of help guide through the process. And that's a big part of what I do.
Absolutely. Talk to me a little bit about some of the things that you recommend for Black women during their pregnancy as well as postpartum.
Sure. So one of the first things I would say is get educated about, even before getting pregnant, about the preconception, about things to expect during your pregnancy and things to expect during postpartum. Build your team of experts, of people whose voices you trust. And that includes your family member too. Like, you get educated, but also educate your family, because sometimes, especially for pregnant women and when they're postpartum, they might not be noticing the changes they're experiencing. But somebody in the family will say, for example, with like mental health conditions, somebody who's been educated with them through the process can say, I'm noticing some of those signs and some of those symptoms. So get educated, make sure that people that you trust, your family, your partner or friend, are educated with you. I'd say start there and really build yourself a team, and don't be afraid to ask questions.
Absolutely. What does this year's theme mean to you personally and professionally? It's a very long title, but
Sure.
What does it mean to you?
Sure. So this year's theme is Healing Legacies, Strengthening Black Maternal Health Through Collective Action and Advocacy. And healing legacies, to me, means that our legacy isn't just about struggle. You know, I think often we're speaking about the struggle. We're speaking about how Black women are having to overcome these statistics, but we are also healing, and we are building a community. We are, you know, I went to an event over the weekend where I moderated a panel for Black maternal health, and there were so many Black women-led community organizations and resources. We are acting, we are advocating for one another, and, you know, that's what it means to me, like really building this community around Black women and Black maternal health.
Dr. Hack, some very important tips. Thank you so much for joining us today.
You're welcome, Michaela.
And to learn more about Dr. Hack and find resources to transform your health, visit ladypartsdoctor.com.